the medication and after withdrawing the medication. And then review the information regarding the medication. Identify the medication's intended action, preparation, side effects, interactions, adverse reactions, and their safe implications. And then assess the size and the general build of the client. So my client or my improvised client is in a well condition and in an average size. And assess the need for assistance. And for the planning, do hand hygiene and perform other infection prevention procedures. And then prepare the needed materials and the medicine. So first is I have here the improvised medication, the tuberculin syringe for the intradermal injection, another tuberculin syringe for the subcutaneous, and the 3cc syringe for the intramuscular, and the chicken for the as my client, the gloves, and the alcohol pad for cleaning the injection site. Also, we have here the small garbage can for the disposal of the syringe. The next is we need to recheck the dosage calculation. And for the implementation, first is we need to introduce ourselves to the client. So, good morning, ma'am. I'm Ian Grace po. So, what's your name po? And when's your birthday po? And how old are you? Okay. So, for today po is we're going to administer the medication through subcutaneous injection. And for the procedure, ma'am, we're going to administer the medication in your skin through the syringes po. We're going to insert the tip of the syringe or the needle of the syringe in your skin. So this return demonstration requires me to touch you po. Would that be okay with you po, ma'am? Okay. So I'm assuring you of complete privacy po since the doors were closed and the curtains were also closed. So shall we start na po? Okay po. We need to assist the client into a comfortable position and then select the injection site and apply gloves as indicated by the agency cards. Following that is we need to clean the skin at the site with alcohol swab using a firm circular motion, starting at the center and widening the circle outward, and allow the area to dry thoroughly. We need to place and hold the swab between the third and the fourth fingers of the non-dominant hand or position the swab on the client's skin above the intended site, and remove the needle cap while waiting for the antiseptic to dry and expel any air bubbles from the syringe. And then we need to grasp the syringe in the dominant hand and hold between the thumbs and the fingers. And use the non-dominant hand, pinch or spread the skin at the side, and insert the needle using a dominant hand at 45 degrees. And then move the for the evaluation, we need to check the desired